A very good evening from Points West. Hundreds of campaigners in Bath have warned the NHS is not for sale during a rally against plans to award more than 200 adult and children's services to a private company. Virgin Care says it won't profit from the £500 million contract and will ensure nurses and carers get more time with patients. Scott Ellis reports.
Branson has already got 2 Caribbean islands. He doesn't need a third one, does he?
Filmmaker Ken Loach rallying the troops, all here worried Virgin Care is about to be handed a 7-year contract.
Don't sell our healthcare.
To run NHS and council care services, including support for the elderly and mental health services in the Bath area.
We don't want to see the NHS privatised, the dislocation that brings, the marketisation, which is costing billions, not millions.
Virgin Care says it's got a track record of bringing in new technology to healthcare, so the likes of community nurses have more time for home visits. The local council thinks a new approach is needed.
You might go to the hospital and then you go back to the doctor, and the doctor won't actually know what they said in the hospital or vice versa. So it's all a little bit of joined up thinking for the future.
The council and health officials say Virgin Care has spent 2 years looking at what improvements can be made in the Bath area, and they say Virgin Care are already looking after 5 million people across the UK, and any profits will have to be put back in to healthcare. But today's campaigners don't buy that.
It's a curious thing for them to have promised, and if they want to do this, I can't understand why they haven't made Virgin Care a charitable trust or a not-for-profit company.
The final decision to award the contract to Virgin Care is due on November the 10th. If successful, Richard Branson's company will have 7 years to prove they can help councils meet a growing demand for healthcare services. Scott Ellis, BBC Points West, Bath.
Existing NHS services which will go. So it's not just Virgin taking over from Sirona, it's Virgin taking over from Sirona and a bunch of other people who do this not for profit but for the public good. So it's absolutely essential we speak out against that. Thank you.
Thanks very much for asking me to come, and congratulations to everybody who's organised this rally. Very important, as the last speaker said, that everybody gets involved. If we can look back, the National Health Service is probably the best expression, the best image of how people can live together, that everybody contributes what they can and everybody takes when they need. And that's exactly how we should live together. The National Health Service is a model for that, and we should be really proud of it and defend it to the hilt. Hear, hear. And it's very clear that this has been under attack for a long time. What's happening now hasn't just suddenly arisen, it's been here for many years. And it's not just about efficiency, it's not just about finding money, it's an ideological attack by the right wing to destroy the very best that we've achieved as a people. And just to show I'm not some extreme old lefty saying it, I've got a quotation for you from a book written by leading Tories some years ago, and this is what their aim was: to work slowly from the present system towards a national insurance scheme. At the last stage, create a national health scheme separate from the tax system. That's what they're after doing, and make no mistake, every step on this path is to do that, is to destroy what you and we together have achieved. Many stages. It began when the cleaners and the caterers were outsourced. It went on through different outsourcing. It went on through private finance initiatives, which to our shame the Labour Party was complicit in. Shame on Blair, Brown and those who did it. And inch by inch, it's been whittled away. And now we're in the stage where the debate, the public debate, is that it is unsustainable. That's the discussion we hear on the television and in the press. God.
I think he agrees with you, Ken.
I thought it was the attack dogs from Jeremy Hunt. And of course, one of the later stages was the Health and Security Act, where any qualified provider is allowed to rip us off. Any qualified provider. That's nothing to do with us working together. It's to do, as was said earlier, with private profits. Which of course will destroy us, and it's also it's in the disguise of efficiency. But just think of the inefficiency of the tendering process. You have to have lawyers to work out the tender. You have to have people to set it, to put it forward. You have then people to scrutinise it. You have the private companies with their PR companies, with their lawyers, with their professionals putting forward the tender. Then it's got to be scrutinised when it's actually taking place. It's bureaucracy, it's PR, and it's nothing to do with providing health service. How much better to employ people directly so that they can do the job and we don't waste all this money on this whole bureaucratic settlement of private companies. Point I'd like to make, and that's the fear, I think, that we have, that the trade deals now being negotiated in secret, it seems. The trade deals will again open up the health service for more private tendering, whether it's TTIP, whether it's CETA with Canada, or whether it's the negotiation with the European Union. What deals will there be to encourage private companies to come and take us over? And it's very interesting, isn't it? I think many of us oppose the European Union as a neoliberal project. Some voted to stay in solidarity with the left groups in Europe. Some voted to leave. But we all oppose that project of the European Union as a neoliberal project. The right-wing Brexiteers were very strong on sovereignty. They were very strong on regaining control. And yet how strange that they're prepared to give up the sovereignty to international secret courts to overrule any government that puts its people first. Where's the sovereignty now? Where's the sovereignty in those negotiations? One other point, there was a poll done recently, you may have seen it, by the Media Reform Coalition, that shows that the proposal the support for kicking out private contractors from the health service has huge popular support. 58% are opposed to private contractors in the health service, and yet it goes ahead. Now, what I think it's brilliant that now we have a political leadership on the left that will kick out the private contractors from the health service. And everyone should get behind that leadership in the Labour Party that will kick out the private contractors in the health service. And thank God Jeremy Corbyn said he'll do it. Woo! Anyway, well done for organising this. One last thing. If it's Virgin, I mean, Branson has already got 2 Caribbean islands. He doesn't need a third one, does he? And if there isn't a demonstration next Saturday afternoon, Twerton Park's a good place to be. Thanks for coming. Brilliant. Well done.
Okay, everybody. Thank you very much to all our speakers. So we're now ready to start marching, but some of you might want to do a bit of chanting as we go along. So we've got some very good chants here, courtesy of Dr. Phil Hammond. So I want you to do a bit of practicing, okay? First chant. It's our NHS, get your hands off it. It's not for sale and it's not for profit. Okay, everybody, after me. It's our NHS. Get your hands off it. It's not for sale and it's not for profit. Right, chart number 2, you'll like this one. Our NHS, it's not for merging, keep it public, kick out Virgin. Okay, after me. Our NHS, it's not for merging, keep it public, kick out Virgin. Right, last 2 for good measure. The NHS isn't overspent, it's underfunded by 10%. Okay, everybody ready? The NHS isn't overspent, it's underfunded by 10%. Right, this is one for hard-pressed doctors. 5-day staff won't stretch to 7, clear off hunt and bring back feathers. Okay? 5-day staff won't stretch to 7, clear off hunt and bring back feathers. Right, now I've got a few copies which I'll hand around to remind you. Now the march is assembling at that gateway, so we'll let Zaria, who's our chief steward, get organised and then fall in behind. Can I just ask that you keep fairly well bunched together so we're not causing an obstruction. Take notice of what the steward said. The steward said we're going to be a very good-natured demo. We've got some leaflets to hand out as we go along, and we'll be going out and down the main pedestrian drag of the city, turning left at Marks and Spencer's, and then round and back into Abbey Churchyard. So, thanks very much for coming, and let's have a good march and make our presence felt.
I couldn't see it, but I could hear it.
I don't know, they might be in the thing.
Yeah, although she's retiring.
Hello, you alright? Yeah, they've stopped Yeah, exactly, we don't know. You know the way?
Oh, right, well, tourists doing the book for what? Yes. Thanks for speaking. Who's replaced you? Michael? You know him. I'm Steve, by the way. I'm husband of Pam.
Banner on the fence. Hello.
When were you appointed to the government?
Take lots of pictures to me, David.
Really kind, but I'm sure they were very few, weren't they? Look when they pick up that many.
Ready? Yeah, we're going to go and stop the traffic. So, well, you go and stop the traffic and then we'll stop. Okay, so when you stop the traffic, you'll know that the speed will start. So when you stop the traffic,
Right. Oh, wow.
Austin,
Where's that? He's round the back. I mean, I'm using up like a ridiculous amount of my data, but... Should we go and see Carl? I've already seen him. What he said was brilliant. Yeah, but have you spoken to him? No. Myrick! Thank you so much. Brilliant. Are you sure you want to carry on? I think you've got enough. Yeah.